kañ nga gëj a dem lopitaan pour nemmeeku sa wér gu yaram
ndax xam nga sa wér gu yaram fu mu toll
est-ce que yaa ngi bàyyi xel si li ngay lekka
wala exercise bokk na si li ngay sóoraale si sa dundu pour am ci lu la leer toppaleen ñu leen di bu ne si suñ programme health check nga xam ne lépp lu ñuy waxtaanee dina méngoo ak sa wér gu yaram.
Hello, my name is Sibo Eric. I'm a physiotherapist and I work here at Oleander Physio Clinic. It's a new and established physiotherapy clinic in the Gambia since November this year. Oleander Physio Clinic, it's just a specialized clinic for only physiotherapy services. Physiotherapy, basically and in simple words, it's the treatment of disease or injuries using physical means that include exercises, what we call manuotherapy, and some people has seen something like massage and passive movements of the body. We have also the use of electrotherapy modalities. That means just small machines that we use to manage pain. And mostly also we use education, advice to change someone's health through adjusted behaviors. So that's basically also what we do, Oleander Physio Clinic. And physiotherapy, it's a broad practice which is also still not known to some of the people in the Gambia, and that's what we are also trying to do, reach out to people, educate about them, because it does help a lot of people change and have better health. So we have a range of services. One of them is sports rehabilitation or sports physiotherapy. This deals with sports injuries and we would say injuries to people, athletes, elite athletes, or just people who do it as a hobby. So that's one thing. We know sprained ankle, knee pain and shoulder pain and other related injuries to sports. That's one thing. Secondly, we have neurological physiotherapy, and this is a branch of physiotherapy that deals with treatment of disease or injuries to the central nervous system, or just nerves, as we could explain. Commonly, we know about stroke. We have other diseases called Parkinson's disease and so many more. So most of the times we would see a specialist referring patients for rehabilitation. So this also includes the use of exercises and electronic modalities, patients' advice and education to change their health behaviors. So this is also one of the things that we do, and as I said, one of the common conditions we have, it's stroke, and a lot of people are aware of stroke. So people don't need to just stay in their houses or just give up on life. So physiotherapy helps to improve and restore emotion and body function or adapt to certain conditions. So it's very, very key to see a physiotherapist in cases of such conditions. Thirdly, we have pediatric rehabilitation or pediatric physiotherapy that deals with specifically diseases that affect children. So we could say one of the common ones is cerebral palsy. It's also one of the conditions that affect the mobility and body function of children. So through physiotherapy, it helps to restore or maintain or also adapt to the condition. So through physiotherapy, a child will grow to have a better quality of life. which is much different from just being at home. So it's basically very important to seek that services in case you have a child having such conditions, or you need even more advice or about the condition. So we also have cardiorespiratory rehabilitation or cardiorespiratory physiotherapy. That means, it basically means physiotherapy that deals with people with heart disease or lung diseases. That we could say rehabilitation after having a heart attack. So this will help you to again restore and adapt or maintain the body functions, and you won't be affected with aftermath of a heart attack. We see people who have they call it COPD, so lung diseases, different and numerous lung diseases. So through exercises, through a treatment program with your physiotherapist, it really helps to restore and maintain the function of your lungs. So it's very important to seek such services in case someone needs it. And lastly, but not least, we have geriatric physiotherapy that deals with people in old ages, let's say 60s and above. We tend to see, because they have reduced mobility and reduced physical activity, they tend to have numerous diseases or dysfunction or things that affect their mobility. So physiotherapy through exercises and managing their pain and educating them. People in old age physiotherapy will aim to restore also and maintain their function and also reduce pain. We've seen people with back pain, knee pain in their old ages, and sometimes it's not necessarily caused by a certain disease, but just maybe the aging, and it's very normal. And at that point, that's when someone would basically need to use our services. Apart from those ones, we also offer off-site services, which are occupational health and ergonomics. This aims at educating and training and advising people in their workplaces to reduce injuries and maintain their health at workplaces, and adapting their workplace to their need in cases of just avoiding the injuries. So this is when we educate people. Maybe, let's say, we've seen people sitting a lot at workplaces, having back pain, so we would come in and explain to them, educate to them, and also assess their environment and see if there is any factor that increases such injury in the workplace, and also help them adapt their workplace for their better health. So it's a wide range of services, and physiotherapy is not new in the Gambia, but it still hasn't reached the wide range of the population. So Oleander Physioclinic is here to also give what we could to help the healthcare system and improve the quality of life of the population through our services. So in any case, we will be here to help people at large through the services. That's basically through physical treatments, as the name would say, physiotherapy. So one of the things that we use, such as electrotherapy modalities, which will show some of them. There is exercises. So these exercises are very different from the ones we're used with in the gym. These are just therapeutic exercises structured to heal or treat a certain condition. If it's low back pain, these are one of the conditions that are very common. So we have a certain program or a certain structured plan to treat such condition depending on how we assess the person or even the cause of the disease. The other thing that we use is manual therapy. This is just treatments using the hands that includes passive movements of the body and massage. So some of the people mistake this profession, physiotherapy, with massage, and it's very different. It's way different. So massage is not harmful. People can have massage at any time, but this kind of massage is very different from what we use, that it's also structured to help the body heal or also maintain a certain function, or just designed to help a certain disease. So, and it's not basically every time a person will have a massage. So some people think it's somehow similar to massage, so it's very different, and depending on how the person presents with a certain disease, we will have a program designed. Sometimes it might not even include massage, so hopefully people will understand that it's very different. Some people, when they see a physiotherapist, they would think of massage, and it's very different, two things. So as would also now, we have a problem when people get to go to massage when they were supposed to go to a physiotherapist for certain conditions or treatment. So after this, I think if you're hearing this and you have been doing it, you would first consult a physiotherapist or come to us. We explain to you about mostly low back pain. People go there mostly for low back pain. We get to know what causes it, get a proper diagnosis and treatment. Then if it's necessary, you could still go for your massage, but it's necessary for a medical personnel to first go through it and see if it's still indicated. Orthopedic physiotherapy, and this is also mostly specialized to deal with disease or injuries to muscles and the skeletal system. So musculoskeletal system, that's what they call it in the medical terms. So basically, one of the common conditions that we see here is low back pain, and research has shown that more than 60% of people experience low back pain in their lifetime. So basically, almost everyone has at least experienced low back pain, and this is also the 5th highest reason to go to a doctor. So most people, the 5th reason, that means out of many conditions that we see a doctor for, low back pain is one of the most seen conditions going to a doctor. So probably we see people who have such pains maybe in the community or elsewhere, and we are not sure where to refer to them. So physiotherapy really helps through restoring the body movements, through the structured exercise programs that I talked of as treatments, through electrical modalities to help with the pain, and through advice and showing you how you can get rid of this pain. And this is medically proven, and it's through research that we know what to do. And it's important to understand that you shouldn't just go to traditional healers or get lost in things out here that people say gels or things that you smear on your back and then you feel okay. I mean, it's very important that you see, either if you're not sure, to see a doctor to know exactly why and how or what brings on the pain, the low back pain, and then you see a physiotherapist. So it has been also seen that physiotherapy is one of the first line treatment to low back pain. So I think it's important to put it out there and let people understand that you could come to us if you have such kind of condition, as we've seen that it's very common throughout the world and also Gambia. For all the conditions and services that I explained, you could reach us out at Oleander Physioclinic. It's just opposite the election house and Sharab Hospital in a white building. It's still near the Cornerstone Center. It's on the first floor. You will see a very big banner written on Oleander Physioclinic. You could also reach us through our social media platforms, Instagram, TikTok, and Facebook, and WhatsApp. TikTok, Facebook, and Instagram, you could search for Oleander Physioclinic. You will see the accounts there. You could always send a message or ask us anything that you want to inquire from us, or just WhatsApp us or call us on 7003598. So anytime you want to inquire about physiotherapy or you want to know anything about it, or you want to visit us, please reach out to us, call us, or send us a message through those platforms, and we'll reach out to you. So thank you for your time, and we will discuss more about the diseases and conditions that we help, and see you in the next edition.